Alzheimer disease versus Parkinson. So I think nowadays people are getting more and more worried about this disease because these are something what do you call it? It's almost incurable. Even you go to hospital, you take medicine, you see specialists. Most of the case, the condition will get worse. So what causes all this problem, all these diseases? Some were saying that because of aluminium. Wow, that will be a very big topic, man. Aluminium, we don't eat aluminium, right? But when we cook, we use aluminium foil. When we drink, we have aluminium can. Either you drink Coca-Cola, you have Fanta or whatever, you have aluminium can. Am I right? If not, then when you drink beer, also you're using aluminium can. So can we avoid aluminium today? I would say no way. No way. Sometimes these are heavy metal that cause a lot of brain damage. And then somebody was saying that antioxidant, wow, if we have antioxidant, this one will help all these diseases. So is antioxidant so powerful? Is it so good? So how about our product, our IM laser and also our CV8? IM laser can supply a lot of oxygen to your brain cell, definitely. And inside CV8, there are 3 main ingredients, whereby these are high antioxidants, you call it fruits or whatever, right? Or supplements. So is this going to help us in our later life? Oh, I mean, all of us are not so old, right? Or is it going to help our elderly friends or our parents? So, okay, I think it's no point. We are guessing here whether it helps or not. Best is now we have our nutritionist, our Lee Mr. Lee here. He's here just waiting for us to get the answer. Hi, 老师，你好。
Yeah, good evening. Okay,
Yeah.
brother and sister, in Ventral
Yes.
Healing Ministry. Yeah. Okay, so I take over lah. Okay, so tonight we are going to talk about dementia, Alzheimer, and Parkinson. Okay, so all the while, okay, we are really afraid of all these diseases, and all these diseases seems to be related to age. All the aging people or elders, or easily they will get all these things, and it seems like all this brain disorder looks quite similar, but in fact there are certain difference in between of all these brain disorder diseases. Okay, so dementia, Alzheimer, and then Parkinson, they look alike, but actually they are different. The cause is different, and then the parts the related brain zone will be slightly different, and then the symptoms also a little bit difference, okay, in overall. And then quite a number of people they might have their this brain disorders diseases in a earlier age, okay, like 40 something or some people, and then without notice it, okay, then it will develop quite a number of other illness, okay, because of this brain didn't functioning properly, and then doctor might misdiagnose, okay, the symptoms that it shows, and then maybe will prescribe a wrong medication, okay, and then you find that even after taking the medication, it won't improve a lot, and then finally you delay the treatment on all these brain disorder diseases, and it will deteriorate very fast, rapidly, and then it causes a lot of problem to the whole body. So it's our duty, okay, to have a brief, okay, knowledge about this dementia, Alzheimer, and Parkinson, or how it happened, and then what we can do, okay, even though some part of it is irreversible. Okay, we can't do much on that, but there are certain things we can do something or to improve it, and then to delay, and then maybe to prevent, okay, the happening of all these brain disorder illnesses. Okay, so we go into a little bit detail on all these brain disorder illness. Okay, so that we learn how to prevent it, and then we know, okay, if there is symptom occur, we can do something at least to delay, okay, at least to prevent it to get further to worsen to get a further deterioration in the brain function. Okay, so the condition become from bad to worse, and then finally it affect the memory loss, all those things. Okay, so when we talk about dementia, okay, when we talk about dementia, actually under dementia, dementia can be considered a very big umbrella, okay, which we will see later on. Okay, it describes a group of symptoms affecting our memory, thinking, and social abilities severely enough to interfere with your daily life. Okay, so the brain are seriously affected until you cannot really control. Okay, you will be lost on your memory, cannot control your thinking, and then your action, social ability. And then it isn't a specific diseases. So when we talk about dementia, there could be many types of those brain disorder illness. They combine together, and then finally they cause all these symptoms, and then we call it dementia. Okay, so Alzheimer actually is one of the most common cause of dementia. Okay, so there is slightly difference. Okay, and then Alzheimer is almost 60 to 70% of people who got this dementia start from having Alzheimer problem first. Okay, so Alzheimer is a specific illness, okay, which are happening in the brain because of certain reason, and then dementia is not a specific illness, is a combination of many types of brain disorder illness which cause, okay, the deterioration of the function of the brain in terms of memory, thinking, and social abilities. Okay, so other types of brain disorder like Parkinson, okay, the effect will be different also. So although dementia mainly affects older people, but it is not a normal part of aging. Not because you are old then you will get dementia. Dementia, we can consider they are caused by illness like Alzheimer. Okay, it's a specific illness, and then Parkinson is due to certain reason it cause damage to the brain. Okay, and then it form this dementia. So don't thought that everyone who get old they will get dementia. Okay, so far we have seen a lot of people when they reach the age of 90 something, 100 even, they still can think very clear, wisely. Okay, and then they can react very effectively, positively one. Okay, so worldwide around 50 million people have dementia. Okay, 50 million, a very big amount also, and there are nearly 10 million new cases every year. So every year, okay, new cases will come in. Okay, and then dementia normally will take a very long time, okay, to develop into serious stage. Okay, maybe it will take you 10 to 30 years. Okay, and then slowly the brain cannot function, and then the loss of memory will be gradually loss of memory and not a suddenly loss of, and then the activity of your what we call the hand, legs, okay, walking, thinking, all this activity will gradually get worse. Okay, and then it would take some maybe 10 to 30 years, okay, to slowly progress. So some people, they might start to have, okay, to go into this dementia in the age maybe 40, then you drag until 70 years old, then they really go into very serious condition, very serious loss of memory, and then lost the ability to take care of themselves, and then it would create a lot of burden, okay, not only to the patient itself, okay, it will affect your family member, because slowly or gradually you won't be able to take care yourself already, okay, like how to brush your teeth, okay, take your bath, okay, maybe how to wear your shirt, okay, maybe you forgot how to do already, and then you have to depend, okay, on your family member to take care. So we can say that, okay, dementia is one of the major causes of this disability and dependency among older people worldwide. Okay, so a lot of old elder people, okay, when they reach the age of 70, 80, they really go into very serious dementia, and then they cannot take care themselves already. Okay, they have to depend on their family, and then it creates a very, very high burden, not only emotionally, physically, and then financially also will be a very big what we call burden to the family. So dementia has a physical, psychological, social, and economic impact, not only on people with dementia, but also on their carers, okay, families, and society at large. So if possible, okay, try don't get involved in all this illness. Okay, take care of yourself in a very early stage. Scientists have already proved that the early prevention action, if you practice, the lower chances of getting dementia you will have. Okay, and then these are some of the changes or signs and symptoms a person with dementia they might have. Number one is what we call the memory loss, which is usually noticed by a spouse or someone else. Okay, you won't be able to really self-notice that you are having this kind of problem sometimes. Only your relative, because you will repeatedly saying something, or you will do something repeatedly or without notice that. And then difficulty communicating or finding words. Okay, earlier when you are young, you are very talkative, you are good in speech. Okay, and then finally when you go into a certain age already, you find that very difficult to communicate with others, because the words that you usually use to describe something, that now you can't find the words already. Okay, very difficult to describe something. There's the communication with other people become difficult, and then this will slowly make you to become more silent. You reduce your habit of communicating with others, because you find that it's quite tough, quite difficult for you to express yourself. Okay, difficulty with visual and spatial ability, such as getting lost while driving. Okay, normally, okay, when they progress into a very serious stage, people with dementia, they might have illusion. Okay, with the visual problem. Okay, they will see something which we normal people will not see. Okay, either is illusion created in the mind itself, and then maybe they will find difficult to remember direction, and then when they are in a space they feel uncomfortable or difficult to really think clearly, okay, when they are in a limited space environment. Okay, so they will easily get lost, especially while driving. Okay, and then difficulty reasoning or problem solving. So the brain start to work sometimes cannot work logically, and then not cannot think logically, and then cannot organize properly. That's why cannot solve some more complicated problems. And then difficulty handling complex tasks, or let's say one trip, or you want him to go many places and buy many things, you start to confuse, and then cannot handle, okay, slightly complex tasks, okay. And then difficulty with planning and organizing. Okay, so just for example, like us, who have to involve in marketing or in direct selling. Okay, you involve a lot of planning, and then how many units you are supposed to sell, okay, to achieve your quota, and then all this need proper planning and organizing. So you might lose, okay, this ability, and then you can't do your work properly. Difficulty with coordination and motor function. That is what we call the neuron which control the function of your leg, hand. Those are neuron for the exercising. We call the motor function. The coordination will start to go down. Okay, you can't, some or even cannot walk properly, okay, at the later stage. Okay, and then confusion and okay, confusion. Okay, you feel very difficult to actually recognize. You get lost when you go to pasar, cannot go home already, okay, because you don't have the proper direction. Okay, so these are some of the symptoms, okay, on the cognitive changes among all the dementia problems. Okay, so for dementia and then Parkinson, the obvious difference, dementia are more in the beginning related to changes in cognitive action, and then maybe some psychological changes, okay, emotional changes, but the motor changes or the motor function, those control the walking, okay, running, okay, eating, okay, all these are motor function, not that seriously affected in the beginning. Whereas like Parkinson, the motor function of the body will be affected first sometimes. Okay, so the action, the shaking of the hands will happen in the very beginning stage. Okay, so dementia, okay, they will experience psychological changes seriously, like personality changes. So an elder maybe the character will change to become like a baby, a small kids, okay, without notice, okay, and then it will behave like small kids, or sometimes laughing, okay, talking, okay, crying, and then the action just like small kids. Okay, this is the personality changes, and then emotionally, okay, they might enter into depression, okay, anxiety, and then sometimes might loss of control on morality, and then they will do some inappropriate behavior. Okay, let's say they don't want to wear their shirt, okay, open up their shirt in the public, okay, and then shouting, crying in front of a lot of people. Okay, all these are change of characters, which normally we wouldn't do that if we are in a proper minded moral way, okay, of daily life. Okay, and then maybe how you produce, you have the this is what we call the parent key. Okay, it means you are very stubborn. Okay, when you decide want to do something, you won't change, or even though they are not right. you still will go for it, okay? And then agitation, okay, you becomes very easily to get angry, okay? And then illusion or hallucination, okay? It means you have all kinds of seems like you can see or something which normally people can't see, okay? And then you will thought that is true, okay? And then you will insist on that. So dementia is caused by damage to or loss of nerve cells and their connection in the brain. Depending on the area of the brain that's affected by the damage. So dementia can affect people differently and cause different symptoms. So there are many types of dementia, okay, which I will explain a little bit later. Okay, so basically, okay, dementia happens when there is damage or loss of nerve cells or damage of the brain cells and their connection in the brain there. Okay, so it's basically mostly because of blood circulation supply to the brain is not that smooth, and then metabolic in the brain is not that good, okay, and then the flushing of waste, okay, from these brain cells cannot be carried out nicely, and then because of the deposit of certain waste and normally some amino acid or some type of proteins which deposit in the all these nerve cells or the brain cells inside the brain there, and finally it damage the brain cells or the brain nerve cells. Okay, so the connection inside the brain there cannot be transmitted nicely, and then it start we cannot get information throughout the brain, and finally it affect also the nervous system that we have, the automatic nerve system that we have that control the whole body motion, okay, the motor function, okay, all these will be affected seriously because of the damage in the brain cells and the brain nerve cells. Okay, so from here you can see dementia. Under dementia, there are many types of different all these brain-related diseases such as Alzheimer's. Okay, the most popular one. Okay, 60 to 70% of dementia are caused by this Alzheimer's disease. Okay, and then this is a vascular dementia. Okay, which are related to our vessel, okay, our heart, and then the all the vessel in the brain there, okay, which in affecting the flow of the blood to be supplied to the brain, and in the long term it affect the brain to function nicely and to get proper energy. Okay, and then the third one is what we call the Lewy body dementia. Okay, I will explain later in more detail. Okay, and then this frontotemporal dementia, Parkinson, this Huntington disease, and then the TBI, traumatic brain injury. So from here we go into a little bit more detail on each type. Okay, when we talk about Alzheimer's, it indicates a type of disease which may cause by the genetic defect in your genetic DNA. Okay, the existing of one of the risk factor among all the Alzheimer 65 to 80% because of the existence of this ApoE4, apolipoprotein E4. Okay, is a type of this protein. Okay, if it happen to exist in the DNA there, then you have a very high chances of getting Alzheimer. And then most of the Alzheimer patient, they have this problem in the genetic in the DNA there. Okay, and then it contribute 60 to 70% of all these Alzheimer cases. Okay, so it's very important. If you want to know whether you get Alzheimer or not, a doctor will test whether in your DNA they contain this protein or not. Okay, and then normally what happened to Alzheimer's patient? Okay, in their brain, okay, they will have plaques and tangles in their brain. Okay, and then all these plaque and tanglers, okay, plaques are clamps of a protein called beta amyloid. Okay, this beta amyloid, because of your gene got some problem, or it cannot really metabolic this protein nicely, and then it causes the accumulation of this protein inside the brain there, and then the deposit, and then it will eventually affecting all the brain cells and then the neuron cell inside your brain there, and then fibroid tanglers, okay, made up of tau protein, okay, another type of protein which the Alzheimer patient they cannot really expel it out, okay, and then these two are the major things which damage your healthy neuron and the fibers connecting them. So when these two things is happening, okay, is accumulating in the all these neuron cells and then the fiber cells in the connection, it will spoil all these cells, and then finally it cannot function. So the transmission of all the signal, all the information in the brain cannot work out, and then it start to affect your whole body, and then it create all those Alzheimer disease symptoms, and then it strongly depends on which part of the brain are seriously affected. So the symptoms might be slightly different also, okay, compared to different types of. And then another types of vascular dementia, just now I've already mentioned earlier, okay, then this type of dementia normally is happen to people or to elders over 65 years old, okay. These are the second biggest group of people who cause dementia. One is the vascular. So especially those who are having heart problem, having the formation of plaque easily happening in the brains, or the vessel in the brain, and then sometimes the happening of what we call stroke, okay, the damage of the vessel in the brain there, it will cause this vascular dementia. And then however, not 100%, not every person who got stroke will have this vascular dementia it depends on which part of the brain affected, okay, especially if those parts which control the thinking and reasoning when the stroke is happening and damage those part of cells or the brain cells, then of course you will develop vascular dementia. Okay, you cannot really think and really organize logic thinking, you will lose the kind of ability. Okay, so vascular dementia can also result from other conditions that damage blood vessel and reduce circulation, depriving the brain of vital oxygen and nutrients. So you can see from here, actually most of the all this dementia they are happening firstly is because of the supply of oxygen, and then the nutrient to your brain is deprived, okay, is going down, cannot be supplied to the brain effectively, either because of the viscosity of your blood, or because of the formation of plaque inside the vessel, okay, or because of the weak heart, all these things, or because of all the neuron, okay, all the nervous system didn't coordinate nicely and cause the supply of blood flow, okay, to your brain, is going down, and then indirectly the oxygen and nutrient are gradually going down from time to time, and then in the long term your cells inside the brain there cannot get what he needs, especially the oxygen and nutrients to produce sufficient energy to protect themselves, and then finally there will be attack by all the free radical, and then oxidation happening, and then finally the brain cells are damaged, and then metabolic inside the brain cell may be going down. Some of the all this protein, all these nutrient or all these metabolic substances cannot be what we call digest nicely and expel out from the brain cells nicely, and then eventually it form together, it clumps, and then it deposit and then cause all the damage to the brain cells. So another type of dementia we call the Lewy body dementia. This is one of the many types of dementia. They are because are causing by this Lewy body. When we're talking about Lewy body, we are talking related to a very specific protein inside the body. We call it alpha synuclein, which our body cannot really metabolize it, and then abnormal deposit of all this protein in the brain we call the deposit, or we call it Lewy bodies. So it depends on which part of the body is having this problem, and then if we find that a lot of this Lewy body is happening, is deposited inside the brain, then it will cause a serious sleep behavior disorder. That means it will cause a very serious insomnia problem. So people with dementia, normally they cannot sleep properly, and that's why for a long-term dementia they will slowly progress, and then slowly gradually form a lot of all these emotional problem, because the brain cannot rest nicely, and then it will cause a problem like dementia, depression, anxiety, all this problem, and then start to kill, to make all the cells in the brain and in the body also cannot repair nicely, because we know that the self-healing of one's body, one's cells all the cells are happening when we have a very deep sleep, during the night. During that time, a lot of hormone, human growth hormone, growth factor, combined with all the stem cell, they function, and then they will restore our cell, repair our cells, and regenerate our new cells. So this Lewy body, if we found that it's depositing a lot inside the brain there, it will cause damage to the brain, and then it will lead to this sleep disorder, and then sometimes even when they sleep they will have a lot of action during the sleep. That means they will move their hand, they will sometimes talking, and then even some when they are in sleep they will walking around, and then they will do some inappropriate behavior, taking off their shirt, or maybe taking a knife, killing something, and then go back to sleep later on, and then without knowing he has done all these things. So this is a type of dementia which are seriously extreme change in the person's character. So if all these Lewy bodies is depositing in different area of the brain, then it will bring different symptoms like the cerebral cortex, which control the what we call the information processing, perception, thought, and language. That we have. If all these areas are affected, then you won't be able to speak certain language, and then you cannot think nicely, and sometimes you can get crazy. Okay, the limbic cortex, okay, which plays a major role in all the emotional and behavior. So sometimes if this part is getting affected, so you can see all those people who are walking around in the street, and then they are quite violent, and then they behave inappropriate. They simply piss here and there, okay, and then talking to the sky, okay, and then if you provoke it, okay, maybe they will come after you and then beat you or something like that. Very violent one. Okay, so if it happened in the hippocampus, which is essential for forming new memories, then you will start to lose to, or you cannot store your new memories. Only those old memory you can remember, new memory cannot form. So you can see most of it in those drama or movie. We can see when they show people with dementia one, they will show they will repeatedly saying something, okay, and then they cannot remember just now they have taken their meal, okay, all this problem. So the midbrain and basa ganglia, which involve in movement one. So this if this part is affected, okay, then the movement will have problem. So especially like Parkinson, this part is seriously affected also. Okay, and then some dementia, a later stage, they might have a problem with the this midbrain and basa ganglia also. But the early stage normally it will affect the cerebral cortex first, which control all the thinking, thought, and then the language first. Okay, the loss of memory first, and then finally it will affect the movement also, and then the brain stem, which important in regulating sleep and maintaining alertness. Okay, so the brain stem, okay, if affected this area, then you can't sleep well, okay, and then maybe maintaining you are not that alert already, okay, you're blur all the times, okay, brain regions, okay, important. Brain regions are important in recognizing smells, okay, will be affected, okay, in this case, and all these will have different symptoms in the this type of Lewy body dementia. Okay, so if let's say this is happening, the frontotemporal dementia, that means the front part near our forehead, behind the forehead, and then behind the ear part, okay, where we have our brain's frontal lobes, okay, and temporal lobes, and then these two regions cause of degeneration, and then you will have different type of behavior that it will happening. So this is what we call the pig diseases. Pig diseases will happen, and then this normally will happen very fast one. Or like Alzheimer, it will develop 10 to 30 years. Like this pig diseases, normally it will take maybe 3 to 10 years, okay, to happen, and then it deteriorate very fast, okay, and then taking only 4 to 6 years from diagnosed to death. So very fast, okay, and not like Alzheimer. Alzheimer will drag very long time. Okay, so it will affect personality before memory shows degeneration. So in this disease, okay, personality change will happen first. Okay, it's not like Alzheimer, loss of memory will start first. This change of character, behavior will start first, and then slowly loss of memory will happen. Okay, so loss of memory, okay, a change in personality can include poor social judgment, distribution, okay, vulgarity, and restlessness, or cannot come down, okay, all the while have to do this and that, okay, and then cannot sleep nicely. Some patient still or show repetitive, okay, they will force to wash their hand very rapidly, repetitively, okay, and then doing something or talking something, okay, repeatedly, okay, and then compulsive behaviors. Many patients become irritable, very easy to get anger, agitated, or depressed. Others are more apathetic. Apathetic, that means even how very big issue, how very big things is happening, but you don't have any feeling on that. Okay, either small thing will make you feel very angry, okay, lost control, or big things happen also you don't have any feeling on that. Okay, this is the symptom of this pig disease, and then it will start begin very fast from diagnosis up to death, because it will progress. The loss of all the function of the body will go very fast, especially those function on the automatic neuron system will be affected. Okay, and then Parkinson. Okay, Parkinson is a neurodegenerative disorder that affect predominantly dopamine producing. Okay, so Parkinson is because of the injured and then of the degenerative of the tissue near somewhere there is what we call the substantia nigra, okay, somewhere here, okay, which are responsible to release dopamine, okay, a kind of hormone inside the body, which is very important in regulating the movement of our body. Okay, all the neuron cells of the neuron function, okay, depends a lot on the release of dopamine. So dopamine plays a key role in the control of movements, okay, while the signal is sent to the striatum, okay. So with the connection and then the communication, and then the messenger we call the dopamine inside he produce here, okay, the brain, okay, can communicate with the all the neuron in the body, okay, the nervous system nicely, especially the automatic neuron. So the healthy balance of dopamine enables precision of movement. Okay, so for Parkinson patient, we will see they have the symptoms of shaking hand, okay, shaking leg, or when they walk, or they cannot walk nicely, or when they talk, they will repeat, okay, cannot talk nicely also. This is due to the degeneration of all these neurons, because of what we call the dopamine produce is getting lesser, and then it cannot communicate well in the brain there. Okay, so what is happening is that all the Levy body is forming inside the nerve cells there. Okay, this is the Levy body. Okay, and then this is nutrient. Because of the formation of this, okay, are due to certain types of all these substances of a protein, okay, which cannot be metabolized by the brain. Okay, so normally when we talk about Levy body's dementia, all this Levy body is affecting those brain cells near the surface, okay, what we call dementia with Levy body is happening here. So Parkinson, okay, this Levy body is forming near the what we call the name of it, how we call it, substantia nigra, this area. Okay, so this area are damaged by also the formation of the Levy body. Okay, so the accumulation of Levy body is associated with a loss of certain neurons in the brain that produce two important neutron transmitters. Okay, chemicals that act as messenger between brain cells. One of these messenger what we call the acetylcholine. Okay, and it's important for memory and learning one. Okay, this is one of the chemical they produce to connect all the neuron all the brain cells in this zone of memory and learning. And then the dopamine plays an important role in behavior, connection, movement, motivation, and your emotional mood, your mood. So if you have this kind of damage in the brain or in this area because of the transmitter is missing, then you will easily form a lot of emotional problems also. Okay, so Parkinson may experience the tremor, there is the shaking. Many arrest and describe as pale rolling tremor in hands. Other forms of tremor are possible. Bradykinesia, this is happening in the body and when walking. Okay, limb rigidity. Okay, the hardness of the hand and then the leg becomes not flexible at all. Gait and balance problems. Okay, cannot walk nicely and then cannot balance the body nicely also. So eventually, it will affect all the neuron that control very important organs in the body, especially like your heart will be affected also, your lung or your kidney, and then you will have a very serious this bowel movement problem because of the neuron is not cannot be connecting nicely. Okay, so you have serious what we call this bowel movement problem. Okay, constipation problem. Okay, so this is how Parkinson normally the dopamine is a type of happy hormone inside the brain there, which control the movement, all the movement one. Okay, they cannot release nicely, and then eventually it will cause a hormone imbalance happening in the body. Not only this dopamine, because of the dopamine, it will affecting other hormone to come down, to relax nicely, and then eventually you experience serious insomnia, and then finally the whole hormone system will get imbalanced, and then it will affect the whole nervous system, and finally your autonomic nervous system will become disordered also. So you can see from here, okay, due to cannot sleep, insomnia problem, then the neuron cannot function, the nervous system disorder, then it finally affect the whole body. Okay, so Parkinson, when slowly develop into a later stage, okay, it will affect all the function of the organs, or maybe it will start to have a kidney problem, lung problem, heart problem. Okay, and then some even when they are in a younger stage, or when they have Parkinson, without notice. Okay, there is the process of Parkinson is happening, okay, and then it affect seriously on the nervous system. Then you will start to have all kinds of all this illness, and then some general practice GP doctor they might misdiagnose, okay, your illness, and then they will prescribe wrong medicine, okay, and then you find that the medication that you use very difficult to overcome the problem, because the root cause is because of the progress of Parkinson is happening in the brain there, and then you didn't notice it. Okay, so it's very important to diagnose it correctly, or either is Parkinson or the other types of Alzheimer or dementia problems. Okay, because the treatment will be totally different. The medication that used will be different. Okay, so if you are taking didn't taking the right prescription of medication, maybe it will make the illness getting worse. Okay, getting deteriorate in a faster speed. Okay, is happening. Okay, so this autonomic nervous system disorder is normally it will happen and then affect your digest system and your bowel movement or your colon is not function nicely. So for those who always have what we call the digest problem and then the explanation, the colon, okay, bowel movement, constipation, serious constipation, you might, you are advised to check whether there's any problem with your autonomic nervous system, and is it the disorder is caused by all this brain disorder. Okay, so earlier when we talk about all those hormone, you can see the imbalance of hormone secretion, especially by your hypothalamus. It will affect your whole body, and then eventually Parkinson is one of the those hormone which will affect the release of other hormones also. So if it didn't treated nicely, okay, it will eventually give problem to our autonomic nervous system, which is very headache one, very difficult, not easy to cure. Okay, once you have this kind of problems. So for all this dementia and then Parkinson, okay, so actually if the problem is genetically, okay, happen in your cells, okay, because of damage genetically happening, okay, in the DNA, normally it's very difficult to reverse one because the repair of your gene is very difficult one. For example, the Alzheimer problem, if it's caused by the genetic problem of this what we call poly E4, okay, that is not so easy to cure one. Okay, and then this Huntington's disease also the same, okay, because of genetically some problem inherited disease from your parents, okay, and then cause a broad impact on a person's functional abilities and usually result in movement, thinking, and psychiatric disorders. Okay, and then this is an illness. Imagine to that is often about 10 to 30 years. Okay, but if it happened in a very young age, or for example, like a kid, few maybe 3-4 years will have this problems already, or this Huntington's disease, it will last 3 to 10 years only. So they won't be able to live, okay, more than 10 years on. Okay, so very fast it will bring death. Okay, and then it seriously affect all the neuron function, the movement. So until all the organs cannot function because transmission of all the information from the brain to control the organs, this automatic neuron system cannot function nicely. Okay, so finally, traumatic brain injury is mostly happen, okay, often caused by repetitive head trauma, okay, especially for those people such as boxer, okay, football player, soldier, okay, they injured their brain quite often one might experience TBI. Okay, that means the brain inside the cells there will get deteriorate and then finally damage. So from here, the damage of brain, okay, due to all kinds of activity, the statistic will be like this. Some people because of suicide, it causes brain damage. Okay, some because of assault, okay, 11% because of this reason, 19% because of this stroke of objects, okay, by objects, 20% motor these accidents, 21% others reason, and then 28% because of falls. So for those elders fall happening, and then it will easily get injured on the brain there, and then this traumatic or brain injury will cause dementia after a certain period of time. Okay, so in order to prevent, okay, because once if those are dementia, Parkinson, or this Alzheimer are caused by genetic effect. Okay, genetically, the brain cells they have got problem on. Quite difficult to overcome this problem. Okay, but those other type because of the supply of blood, because of the metabolics of certain protein in there is not doing well and cause all the deposit, all the Lewy bodies, it might be able to prevent if we can do something in the early stage, and maybe it can help to slow down the process, or maybe to stop the process of happening in a very speedy way. Okay, so in order to overcome this problem, we have to take our prevention steps when we still don't have any signs or symptoms of dementia or Parkinson or Alzheimer. Okay, so from just now what I have explained, you have already have a clear picture the difference between Alzheimer, dementia, and then Parkinson, right? Okay, dementia is because of genetic problem, and then the formation of this what we call Lewy body in a certain part, and then the metabolic of a certain protein, okay, inside the brain is not functioning well, and then they find out of genetic problem, okay, the excess of this poly E4, okay, in the brain there, and then it developed, okay, the problem of Alzheimer's. Okay, so Parkinson is because of the substantia nigra there, okay. The formation of Lewy body is very high, and then it causes damage to this Lewy substantia nigra, okay, which responsible to release the hormone of dopamine, which control the movement of our neuron. Okay, the movement of our body to control the neuron of movement. Okay, so other types because of the damage caused by the everybody in different parts of the body, or some genetic issue, okay, heritated from your parents, okay, and then it causes the many types of dementia there. Okay, so in order to avoid and then to take prevention, scientists have already analyzed, and then they find that the formation of this, beside genetic problems, which we really cannot do very much on that, even though we still can improve it and then to delay it by supplying certain nutrient like ginseng oxide, okay, which are proved to have some effect, okay, on regenerating, restore, okay, our DNA inside the brain there, okay, but we find that it's not easy task. It's a very difficult task to do that, okay. But beside that, we can others problems are the metabolic problems, and then the supply of oxygen, nutrient to the brain's problem, the creation of energy on the cells of the brain cells. All these problems are gradually, okay, make the brain cells to deteriorate, don't have any the energy to protect itself, and then finally was damaged by all the Lewy bodies inside the brain cells there. Okay, so in order to improve it, we must first have this smooth blood circulation, very, very important. Okay, and then because with a smooth blood circulation, we can supply oxygen and nutrient to the brain, okay, effectively. That's why in the use of IM laser, besides using on the wrist, we'll put a special light target on the nose there, so that the light can go into your brain more effectively. Okay, so that the light, the photon, will help to boost up, to speed up the generating of energy, okay, in the brain cells. Okay, and then it will help the cleansing of all the blood cells also, so it bring a smooth blood circulation. So finally all the nutrient that supplied by this CV8 can be distributed to your brain effectively. Okay, and then secondly, okay, of course, mostly all the damage in the body, especially when we talk about cells, is caused by free radical. Okay, oxidation is happening. So in the brain, it's same also. If oxidation, it will damage all the cells inside here. So antioxidant property is very, very important. So to avoid, okay, the damage, okay, by all these free radical. Okay, so CV8, okay, with the combination of the wild ginseng stem cell, okay, the phytochemical it produce, and then cipaton, and then the ammonia fruits, aronia fruits, and then the pomegranate fruits, okay, which are all highly contained in this antioxidant property. Okay, and then the use of IM laser in the process of producing the ATP, it will create, okay, nitric oxide. Okay, nitric oxide is a very strong antioxidant property also, and a very good, okay, this neuron transmitter agent, okay, which will help a lot in the neuron transmission. Okay, and then with all this supply, okay, of antioxidant, we can really protect all the cells inside the body and in the brain here, so that it won't be easily to be affected, to be attacked by all the free radical and damage the brain cells. And then with the help of the combination of all the nutrient, all the essential fatty acid, okay, and then essential amino acid, the body needs all the amino acid, and then vitamins, minerals combined with a very perfect combination of a formula of this cipaton, aronia fruits, pomegranate, and then the wild ginseng phytochemicals. Okay, so all this will provide a well-balanced nutrients to the body. Okay, and then all this will help to balance our hormone control. Okay, especially to control our blood sugar, because scientists are already confirmed, okay, because of high blood sugar will easily cause, okay, the this oxidation, okay, and then damage to the brain cells, and then will easily form all the plaque, okay, all the blockage on the capillary of all the brain cells. So to control our blood sugar is a very important step, and then the use of IM laser, and then this ginseng CV8, okay, both also will give a very good effect on controlling our blood sugar, and in fact it can control the three high blood sugar, high cholesterol, and then high hypertension, blood pressure as well. Okay, and then it will help a lot in the balance of our hormone, or especially the use of IM laser can promote a very good sleep, and then the nutrient, the tryptophan, it contains an essential amino acid that the body require when we want to promote a better sleep, or in the creation of the melatonin hormone. We need a tryptophan, which CV8 will provide you, and then it will give you a very stable and sleep, and then finally it balance up your hormone also. Okay, and then of course, with the help of eye laser and then the CV8, okay, the good sleep quality will present, okay, and then stabilize your nervous system, okay. Just now we have already know because the communication among all the cell system, organs, and the brain are going through by two way. One is your endocrine system, include your hormone, okay, which normally it will release into the bloodstream, and then our communication will happen, okay, by traveling of all these hormones from the brain to all the glands, and then from all the glands to all the hormones, okay, in the respective area of the body, okay, and then the other set of communicating is through the nervous system, okay, all the neuron in the body and then in the brain there, okay. So both eye laser, okay, and then the CV8 can promote, okay, can give very good control, stabilizing of your nervous system. So it can calm you down, promote good sleep, and then during good sleep, okay, you can repair your body. Then your body can communicate nicely among all the system, and then all the neuron can be connected, and then instruction, the automatic neuron system can perform nicely because the transmission is clear and sharp, and then repair can be worked out during the night. So all this will help the brain to release all the good hormone, all the happy hormone, or like dopamine, okay, like what we call the there are all the happy hormone, okay, that we normally like to have, okay, and then it will help a lot in calming down yourself, and then it will make you to be more emotional balance, okay. Fluctuation won't be that strong happening inside the body, okay. So this basically what we require to make our body, okay, to prevent damage on the brain cells, okay. So we are recommending Ventral Ceiling Ministry recommending the use of eye laser and then the CV8, and then with the combination of our serum also, it will give you the benefit of improving all the function of cells, and then the organs inside the body, and then various type of system inside the body will work balancedly, and then eventually it bring very good antioxidant effect, okay, and then protecting your brain from the attack of all the free radical, and then it might improve, okay, some of the nutrient that supply to the cells might improve the formation, and then the protection against the DNA, okay, so that your DNA won't simply change or alter by all the virus, or because of the change of environment, damage is happening inside the body. Okay, so this is why we recommend the use of eye laser and then CV8 when we fight against this brain disorder problem. Okay, because it can bring you a very big good effect on controlling the cells, restore the cell, repair the cell, and then regenerating the cells in your brain. Okay, and then to protect them against the attack of free radical, and then happening of the oxidation, okay, of the brain cells, and then the neuron cell in the brain there. So antioxidation is happening when you take your CV8 because it supply a lot of antioxidant substances, and then the use of eye laser, okay, will produce nitric oxide, which is a very good antioxidant property also, and then it increase, okay, the formation of energy, okay, the produce of energy inside the brain cells, so that the brain cells are more powerful, okay, to protect itself from the attack of all these viruses, infection, and then the environment changes in the brain there. Okay, so here roughly let you know what is I'm laser. I'm laser actually is a medical device. Okay, remember is a medical device approved by this FDA, or is a medical device, not a health device. So medical device approved by FDA, they have to meet a lot of high standard requirement by the international body, okay, in terms of safety, and then the effectiveness, and then the quality of the products. They have to meet certain standard, only they can be recognized by this FDA. And then I'm laser and get all this certification, and is certified as a medical device. So it's a medical device grade of products, so it's very safe and confirmed to be effective in providing good effect to the health, and it won't bring any side effect on the use of this light. Okay, so I'm laser is a combination of three what we call the therapy in oneself. So from here, you can see all the certification. Okay, you can get detailed certification from all our agents if you are interested to know. Okay, and then please, okay, look at it on it. Okay, there are so many, and then these are FDA, and nowadays a lot of people, those are athlete in the Olympic Council, and then the astronaut in the NASA, they are using this what we call the light therapy, this laser therapy, okay, in the treatment or protecting or promoting their good health. Okay, and this is not new things. Okay, actually the discovery of light, the photon inside the light, already more than 50 years study, and then practical, and then testimonial on this, and then a lot of clinical study on the light, the use of the light has been established, and a lot of medical journal, or you can simply go to Google, okay, and search for low level laser therapy. You will get a lot of medical journal, because in the whole world, all these very famous university, they are studying the use of all this light in the treatment of illness, how it benefit, and how it function inside the body to give a very amazing result to our body. Okay, so I'm laser is a photon, okay, that is exists in the light, in the sunlight. Okay, we call the photon, okay, is in the light with a frequency of 650 nanometer. Okay, we call it the light of life. Okay, because this photon in the sun, actually the molecules look like this. Okay, or the neutron, look like this. Is an energy, and it has a very great effect and influence on the enzyme reaction of the human body and the energy production of cells. Okay, so this is how it functions. Once it has been created in a form of look like a watch. There are 6 laser head all in. Okay, 4 will target on your wrist. Okay, on the all the bursar there. Okay, so here all the blood cells will go through, and then there are 4 targeting on the bursar here, and then in the middle there will be another point. Okay, targeting on the meridian, the 内关. This using Chinese way of medication. Okay, and then the other one at the side, which will go with a line, okay, which will act as a needle in this acupuncture therapy. Okay, we use it as a needle. Okay, so we are using the light needle, okay, which won't give you any pain or any side effect on that. And then if you don't know how to use the meridian point to treat some of the illness, or to activate the meridian point to clear, okay, all your meridian system. Then you can directly put on to your nose, so that the light will go into your brain, and then it will activate the cells inside the brain effectively. Okay, so the first we are using the light therapy, the laser therapy, and then secondly the needle, the light needle, okay, will act like acupuncture needle, okay, and then you will easy access to 361 acupuncture points and meridian, and then you will cleanse, okay, cleanse all this meridian system of the human body. So pain, when the meridian is not working smoothly, it's blocked, okay, when we call the meridian system is blocked, then it will create a pain. Once it's clear, the pain will go away. Okay, this is the theory of Chinese Oriental this theory of meridian okay, the qi shui the qi and the blood flow inside the body. So by activating all these important points, the nei guan, okay, you can activating the flow of the qi and the blood in all the meridian system. Okay, so beside that, it acts as a magnetic therapy also. So without on your arm laser also, it will provide magnetic field, which will magnetize the blood cells, and then the system, the cells inside the body, to make the flow of the blood increase tremendously, because the study of Oriental medicine, okay, under Japan and China already proved that, okay, almost 1,000 years ago, and then a lot of study and then medical journal on the function of all this magnetic therapy in reducing inflammation, improving, okay, your blood circulation, and then reducing the pain, okay, that you suffer, is very, very effective. Okay, so it combine. So when you use the arm laser, this will happen inside the body first. The light, when it go into your bloodstream, okay, through the wrist there, okay, so all the photon will activate all the enzyme in the blood there, okay, will trigger, promote the activity of the enzyme, and then all this enzyme will have the function of cleansing all your blood cells to make sure the electron on the blood cell can function nicely, okay, and then eventually it will make your blood cells all opens up, and then it can flow nicely. Okay, so it give a very, very strong and super blood purification effect. So once your blood can flow very nice, very fast, it can get oxygen, and then the nutrient contained in your plasma can be delivered, okay, to all the cells very effectively. Okay, if you didn't use, you will see how they all clump together. Okay, they look like the intestine of the pig, and then it's very difficult to flow, and then the supply of nutrient and then the oxygen will get lesser inside the blood, and then in the cells they won't be able to get all this supply, and then the generating of energy will get lesser, and that's the beginning of all the deterioration of the function of your blood cells, of your cells. The metabolic will slowly goes down, and then it cannot really metabolize certain type of protein inside the cells there, and then eventually it causes all those Lewy bodies, okay, and then it damage the cells, okay, especially when it happen in the brain, okay, and then this will cause the brain damage. So this is very important stage. Okay, so second stage, all this photon, okay, when it travel, okay, with the blood cells, and eventually it will reach all the cells. Okay, so inside the cell there is mitochondria, okay, and then this mitochondria contain type of enzyme we call the cytochrome oxidase C will be this enzyme will be activated by the photon. So we know that photon have a very special effect on activating all this enzyme. Once the mitochondria enzyme is activated, then the mitochondria will start to use sunlight, oxygen, water, and nutrient that you supply to the cells, and then they will go through a process we call the biostimulation process, and then finally it will produce ATP. There is the energy that the cells need in the form of ATP. The more ATP that you have, the stronger your cell is, and then beside that, it will produce ROS, and then this nitric oxide also, a very strong gas, which will help to purify your blood, to strengthen the elasticity of your blood vessel also. So a very good antioxidant property also. Okay, so this is a process where you get your energy, your temperature will rise because of the activation of light towards the enzyme in your mitochondria there, and then the process of producing ATP will be speed up, metabolic in the cells will get better, and then the metabolic of all kinds of nutrient, protein inside there will be more effectively done, and then the formation of the Levy body will not be easy to form inside the body. Okay, so we know that when all the cells have become very strong, and then eventually the function of the cells can perform better, especially in the brain there. All the metabolic of the brain cells can perform better. Energy is more higher, in the brain there, and then it can protect against all the attack of all these free radical, and then all this formation of unnecessary proteins, which will clump, and then which will cause a deposit in the brain cells there. So a strong cells will help the function of all the organs. So we know the whole body's organs are made from cells, so eventually it helps the whole body to strengthen the function of all the organs. So from here you can see the neuron cells, our white blood cells, or our bone cells, and then all different types of our heart cells, our liver cells, they will be improved. Our skin cells, through the promoting, the production of the energy inside the cells. So eventually all these organs, your lung, your heart, your liver, your intestine, your stomach, they can perform their function nicely. And then the combination with the use of different organ tissue, and then the blood system, and then the endocrine system, it form all kinds of system in the body. And then with the help of all this endocrine, and then the neuron transmission, which need a lot of all the nutrient that you need, especially when we talk about neuron, we need a lot of all these minerals, trace minerals, which are highly contained in Cypaton, in CVA. And then this can strengthen the transmitting rate of all the neuron system. And then with a proper supply of tryptophan, a more balanced creation of happy hormone in the brain there, it promote a better sleep. And then it create more this human growth hormone, by your what we call pituitary gland, and then promote the formation of all the growth factor in your liver there. And then eventually when you sleep well in the night, then repairing of body will happen, and then it require all kinds of nutrient also during this time in the restore and then the repair of all the cells. So CVA provide you with all the necessary nutrient, okay, beside your 3 meal. Okay, so balance various body system is in the head body is happening. So include your endocrine or your nervous system, your muscle system, your bone system, okay, circulation system, and then your lymph system, your what we call the anti immune system inside the body. So you can see all these systems when they work smoothly, balancedly, okay, the middleman, or we call the inner doctor, okay, your self-healing power is the middle one, which control all this system one. Okay, it becomes stronger, and then it will self-healing yourself, repair, restore, regenerate your whole body when you have a very good sleep in the night. So during the night, they will use all the nutrient that you supply to the body, and then do all the process of restoring and the process of regenerating new cells from cells to all your all this digest system, absorption manner, and then good sleep, okay, stable nervous system, okay, and then finally very strong production of your energy in every cells inside the body, make you more energetic or more the very strong immune and vitality. Okay, so this is happening inside the body with a combination of use using IM laser and then CV8, and then eventually it can help, especially the use of IM laser itself can help already clinically tested and confirmed. It can help 8 major body system, almost 80 types of health issues, okay, ranging from circulatory, okay, your nervous system, your hormone system, your energy system, okay, your productive system, okay, and so on. Okay, this is the function of IM laser, how it helps the body cells to restore, repair, and then to regenerate. Okay, and then during promote good sleep, and then during the night it help the working of all the stem cell in our body. Okay, or not only the light will help, okay, the CV8, which it contains the wild ginseng stem cells and all the phytochemical, okay, it produce, okay, and then all the ginseng oxide, okay, it will help a lot, okay, in this manner also. So CV8 is another product, okay, actually is formulated by this research center, a research institute formed by, okay, Ventros, okay, our company, this Korean company called Plantel, and then the Chinese Medical Science Academy, and then Sydney University. These 4 different entity, or they form the research institute, and then finally they come out with a new product, new formulation we call the CV8. Okay, inside here we are using a major, a very important discovery of a technique of how to filter the stem cell of the wild ginseng, especially the very old wild ginseng, the stem, filter out the stem cell lively, okay, and then using a technique to replicate and reproduce, and during the process enable to produce all types of phytochemical, which are very rare and very effective in handling in fighting all kinds of disease and general health improving in our body. And then with the discovery of this technique, which have already been patented in almost 86 countries, because this discovery is the only one, and then is the only one, and then is the first and then the only one, okay, a technique, okay, patented by this Plantel, okay, to extract or to filter they call it to filterize lively, okay, the stem cells of this wild ginseng, okay, Korean wild ginseng. So this plantel is the only one, and then is the first one to successfully, okay, filter out the what we call the stem cells of this wild ginseng, and replicate, and then produce all the important phytochemicals, and then the ginseng oxide, very rare ginseng oxide that is inside the wild ginseng, Korean wild ginseng. Okay, so the 160 years, all the while, okay, 160 years, okay, scientists have been trying very hard to discover it, but they are not successful. Now, actually, the plantel have come out with this very high advanced technology, and then is able to preserve, and then they have created the bank, the stem cells bank, for all the plant that is very rare or very expensive, okay, to very difficult to plant, okay, and then those substances that we want to derive or extract from all these plant have to go for many years. Like wild ginseng, if you want to wait for the wild ginseng to grow until it will produce a lot of rare ginseng loci, then you have to wait maybe for 50, 80, for example, like the CVX, these stem cells, it is produced from a wild ginseng which is 80 years old, very old already. So we cannot, if we want to plant the ginseng and wait for 80 years, then it will be very costly, because nowadays wild ginseng very difficult to get, and then very costly, and then it will take very long time. It's not practical, okay, for people to take wild ginseng as a raw material, okay, to produce, okay, health food or for daily use. It's quite impossible to extract, and then cannot get so many wild ginseng, and then cannot produce so many wild ginseng in a very short period. So far, all the wild ginseng that we the ginseng that we enjoy in the market mostly are just those people plant one, okay, maybe it goes only 5-6 years only. All the wild ginseng is very expensive, okay, some will go above 100,000, some even million, if the wild ginseng is quite big one, okay, quite heavy one, it will cost $1 million one. Okay, so with the creation of this technique, this advanced technique of preserving, okay, the stem cells of the wild ginseng, and then the development of a reproduction, replicate of the wild ginseng, and then the production of the phytochemical, and then the ginseng oxide, okay, of the wild ginseng. Okay, so now, okay, we are able to preserve, and then with a very stable and consistent manner, and then we create in the mass production, and high concentrated phytochemicals can be produced, okay, using this technique and this method. And then okay, from here you can see all these tank, basically they are produced from one stem cells, and then it can be produce, replicate, and then finally, or you produce all those phytochemical, which is equivalent, okay, to 75,000 pieces of wild ginseng. The extract of wild ginseng of 75,000 pieces is contained in only one tank like this, and then is produced by having one stem cells, okay, the creation of the stem cell, replicate of the cell, reproduction of the stem cell, and finally we'll get all the ingredient. So we say that from one it grows to infinity. That's why you put the logo or CV8 infinity. Okay, so these are some of the very important ginseng loci, the ginseng loci RG3, PH3, APPD, ginseng loci RG5. Okay, they are very strong. Study proof that very strong in anti-aging. okay, anti-aging, anti-cancer as well. Okay, it will improve blood circulation system, improve our liver function, okay, and then it strengthen our immune system, okay, and then this PH3 anti-cancer and then dementia, okay, the loss of memory and then the weakening of all the brain cells, and then ginseng oxide RG5, okay, it will improve the function of the brain, okay, anti-cancer or anti this sugar, okay, improve for diabetic, okay, and then depress C type of hepatitis, okay, inflammation, okay, and then will calm down emotion problem, okay, have very good effect in calming down our emotion, our nervous system, okay, to give you a very good sleep. Okay, so this IH2 RK1 will give very strong anti-cancer effect by cutting off the supply of all the nutrient and then the blood to the scan cell. So this cancer cell will get into a starving, okay, condition, and then finally it will die off. Okay, so these are all the effect of all the ginseng oxide inside the body. And then beside that, okay, CVA also contain all these essential fatty acid, okay, which will involve in the immune response, okay, and then anti-cancer effect also, okay, and then is a very good antioxidant property, okay, can prevent all the heart and then the vessels problem, which will lead to this vascular dementia, okay, and then it protect our neuron, okay, in our nervous system, and then anti-cancer, and then these are all the vitamin B or group of B, okay, which will have a very good effect in immune system and then antioxidant, and then the OPC or the antioxidant property is very high to avoid the attack of what we call the free radical and then the oxidation process. Okay, and then finally they are all very strong in helping to fight against cancer. Okay, so this basically some of the nutrient we can say all the nutrient that the body needs, okay, are contained in this formula CV8, okay, to make sure we will replenish, okay, the nutrient that you are short of, even though we can't say that CVA will supply all the nutrient and then replace all your meal. Okay, we can't say that, but it will contain all the nutrient that the body needs in a certain quantity, so that to make sure replenish, okay, beside your 3 meal, any shortage of a nutrient in the body, CVA will replenish it. Okay, it will contain certain level of all these short deficit when we face, and the CVA will contain it. Okay, so because for example like Cipaton, it contains 190 types of all kinds of this active ingredient, okay, include all kinds of omega 3, 6, 7, 9. So those vitamin which need to be dissolved in the oil one, okay, that can be absorbed in a better way with the combination of the all this omega, okay, and then it contains all the vitamin from A, C, E, all those vitamin is inside Cipaton, and then the all these minerals, okay, from calcium, magnesium, okay, it contains very high percentage also, okay, and then the beta glucan, okay, beta carotene, and then all the OPC, okay, which is very good in antioxidant, okay, and then it can reduce blood glucose, and then help to fight against cholesterol, okay, and then it will help the growth of your what we call the stem cell inside the body, and the use of our own stem cells. Okay, so aronia fruits, okay, the kings of berry. Okay, it contains all the antioxidant property, a superfood. Okay, so all those OPC, and then English, I forgot all this name already. Okay, they are all very strong in fighting against oxidation. Okay, and then it's very good the berry alone to fight against a digest problem, okay, your lung problem or your breathing problem, improve blood circulation, or maintain a very good health, a good heart and liver, okay, and then a general protection to the immune system of the body, and finally this pomegranate fruit, okay, it contains all kinds of minerals and vitamins also, okay, and then it's very high in antioxidant property, and then it will help a lot in reducing the blood pressure and cholesterol, okay, improve your digest, okay, anti-aging, okay, improve, okay, all this joint pain, okay, reduce pain, and then improve heart health, okay, all the heart problems. Okay, so this is why is so effective in refurnish, okay, and then supplement to the body's needs of all kinds of nutrients, not only all the vitamin, and then what we call the minerals, or it contains all the essential amino acid, essential fatty acid, and then a certain level of carbohydrate also. Okay, so these are complete all the nutrients that the body needs inside just in terms of quantity. Okay, so we won't ask you to take CV8 to replace all your 3 meals, because it might not be sufficient in terms of quantity in certain property. Okay, so we are using CV8 as a supplement to make sure it will cover those which your deficit, not enough in your 3 meals. Okay, so with the combination of the use of this formulation, or the CV8 and then the IM laser, it will definitely give a very good preventive action in protecting your brain cells from deteriorate, from damage, and then it will help to repair, restore those damaged cells, and to help the brain to segregate good hormone to make you feel more comfortable, more relaxed, reduce those cortisol effect on the brain to make you feel very nervous, pressure, and then it promote a very good sleep for you, and then repair of all the function of the cells and the balance in the body can be carried out effectively, okay, because your hormone can be balanced, and then your neuron can be balanced up with the use of the nutrient, and then the light, okay, which will promote the increase of the production of your ATP in your brain cells. And then with a high quality of sleep, all the hormone, all those good hormone will make you feel better, more relaxed, more comfortable. So in the overall, okay, the combination of the use of IM laser and CV8, number one, it is a very, very strong okay, we go super strong antioxidant effect will bring. Okay, this I've already mentioned, okay, earlier. Okay, and then there are studies to show that with the help of CV8 and then the IM laser, okay, the DNA the DNA, the theory of DNA can be improved, okay, because of the process of this what we call how to call it here, this process on the DNA side, it will be prolonged, and then it will delay the process of all the cells, okay, and then it can be achieved by the use of CV8 and ion laser. So your brain cells can be improved, and then the improvement on this will delay the aging process, and then help improve your overall immunity, okay, because all the ginseng oxide can give you very good effect on this, and anti-cancer effect. Improvement of your endocrine, and then the neuron, and then the balance function of all the system inside the body. So you have a coordination and operation of the major system in a very harmony way, and then the repair, restore, and regenerating of all the cells can be done effectively. Number 5, okay, you can see balance your blood sugar in your liver there. So this can be done by providing more nutrient, and then the effect of the light on the liver cells, okay, it can significantly improve the function of your liver. Okay, finally, the improve of your blood circulation system to make sure the supply of oxygen and then the nutrient to your blood can be more effectively, and then this is the improvement that normally you will see under the microscope, okay, under the live blood analysis, you will discover the amazing improvement after half an hour of use. And then finally, it promotes growth factors, enhance stem cell function, accelerate the repair and production of cells inside the body. Finally, whitening the spot removal, fat reduction, wrinkle removal, and slimming beauty effect. So if you want to double or triple up the effect on the skin, you can add in the serum, also made from this wild ginseng, with the addition of all those antioxidant, and then some of the amino acid that protein that need to firming up your skin, and then make your refine all the line, all those things, and then removing whitening material, which will make your pigmentation away. Okay, then you can use from the outside the application of this serum, okay, to further speed up the improvement on the beauty side from outside. So with the use of it from inside, it improve your health, repair, restore, regenerate your cells, improve your organ function, and then balance up all the system function, and finally, okay, it improve delay, okay, the aging of all the cells, and then improve very good grand endocrine system, make you sleep better, with help of balance this new neuron and then nervous system. Then all the function of the body can work out balancedly, and then with the help of all the nutrients that supplied by CV8, of course, amazing beauty effect will start to happen, and then it will enhance your energy, your vitality, okay, and then very high antioxidant, okay, it improve, okay, all your and anti-cancer, okay, and then finally, okay, you will get regaining youth is no longer a dream. Create a brand new you from inner health to external appearance. Okay, so not only it can improve in all the dementia or the brain disorder problems, or it can regain your youth or your activeness, your strength, okay, from inside to outside, and then your beauty, your slimming, and then your glow of your skin, okay, all these are no longer a dream. It can be achieved by the use of the restoration package recognized by Ventos Healing Ministry. Okay, that's all I want to share tonight. Okay, I share up to here. Luckily,